Hey, thank you so much for your patience with the recording. They have been a little wonky in the past. I'm doing my best to give you a really good view of the screen and what we're seeing. My name is Jodi. My name is Jodi Scholes, and I'm your instructor for today. It's my privilege, my pleasure, my honor to walk this part of your journey with you. Honestly, I remember what it was like to be in school and to graduate and to be like, oh my goodness, like what now? And that time between when you graduate and when you actually have a professional license, that time between when I graduated and I got my professional license. For some people, that's like right away. Other people, it's a longer journey. And maybe there's a different job that supports getting you to your license. Whatever that space looks like, the space between when you graduated from massage school and when you get your professional license is different for everybody. I have people in this class right now who graduated 17 years ago, before there was an MBLEx. And they said, I don't need that. I don't need that. I'll just get my license. For example, in California, you used to be able just to get a license by applying and going to school and applying because there was no national exam. And then there was. And if you're like many massage therapists, details aren't your strong point, like me. I like big pictures. Sometimes details get a little boring. And in this case, this massage therapist, her license expired. And she knew, like, she got notices. Yeah, I'll renew it when I need to renew it. Oh, I didn't renew it when I needed to. Oh, it's been a year. How long has it been? I don't remember. After 2 years, she couldn't renew her license. She had to retest. And so no matter what that journey looks like, it is perfect for you. It is exactly what you needed. Maybe you didn't get your transcripts. Maybe you didn't feel comfortable testing right after school. Maybe you thought you'd study a little bit more. It's all perfect because you're listening right now. You're here right now. And that's a message from yourself to yourself. Sometimes I like to say a message to the universe, but it's a message from yourself, from your intuition, to who you are today, that you're ready. Look, sometimes life gets in the way, babies or family stuff or a really good job opportunity or travel. Again, it's all perfect because you're listening today. And today is the present. We only exist in the present. Fear, worry, regret, resentment, bitterness. Eckhart Tolle, in his book, The Power of Now, tells us that fear and worry is evidence of too much past or too much future in our life and not enough present. So I invite you to get present. Maybe put both feet on the ground. Feel those, wiggle your toes, wiggle your fingers, stretch your fingers. Feel the weight of your body in your chair or on the floor, wherever, or on your mat, wherever you are, normally in your chair. But feel that weight and let that anchor you in the present. Because our subject matter today is going to be reviewing the content outline. So the Federation of State Massage Therapy Boards is the federal organization currently responsible for the questions that show up on the MBLEx. And so we're going to be reviewing that content. And that content is kind of intense. I sent you a copy. If you're on my distribution list for classes, in fact, I've invited you to go ahead and say, oh, hell yes, or yes, please, or yes. If you would like to stay in touch, because this is our last class of this series. Can't believe it. Can you believe it's March 15th? So those of you who are watching later and it's not March 15th, can you believe whatever date it is, that it's this point in the year? It's a perfect day. It's a perfect day, but we've been through 10 classes together in our spring session and our online learning. And this is the last live class in that series. And so if you would like to continue to get email notifications from me, encouragement, strategies on passing the MBLEx, feel free to email me at jodischoles.com. And I think that's somewhere on the screen. My name is over here. Ooh, right there. So that's my name, Jodi Scholes. I'll put it in the chat as well. Not that you guys will see it, but Jodi at jodischoles.com, and just say, yeah, hell yeah, stay in touch. Because I'm moving from this Zoom platform onto a platform that is free. The free platform is Patron, and it comes from the idea. Have you ever heard of like being a patron of the arts or patronage? Like if there's a theater, sometimes there's like reserved seats for patrons, and those are people who have donated money. Patron.com is a website that I'm participating with now that allows me to broadcast like this, to upload content, and it all stays in one place. And it lets me stay in touch with those people who want to stay in touch. So patron.com, and again, my name, Jodi Scholes. So for those people who want to just say yes, we'll get you connected with Patron, and you'll continue to get encouragement and strategies and some video. Won't be every week. You can still watch the YouTube videos. Those are staying up. Oh, I was going to show you what that looks like. This is the Patron site, my Patron site. And it looks a lot like my screen today, but this is where we'll meet. And you can see already that there's resources in there for you. And it says here $90 a month. It's free. You don't have to pay anything for this. You just sign up. And a number of you, actually not a number of you, but in the past, some of my students are like, ooh, $199, Joe, that's a lot for me right now. And so I'll run a periodic special that makes it just $99. And I'm very grateful for those of you who invested in yourself. But there are sometimes people are just, they're not working. And so the patron site allows you to be a patron of me. So just like if I was the theater, you can be a patron of me. This is all about MBLEx prep, and you can donate. You can just show up and be a supporter, or you can be a patron. You can donate $1 a month, $5 a month, whatever works for you. And this is allowing me to make this material accessible to everybody who wants it when they want it, not just 10 weeks or in a spring session or in a fall session. Oh, you're lucky you got in at the beginning. This you can do as much or as little as you want. So that's the reason for the, my motivation was that with this class ending, I was sad. I really love teaching and supporting you, encouraging you on this part of your journey. The journey between graduating from massage school and getting your license. This is a squishy part of the journey. I say squishy. It's a part of the journey that can be really hard. Sometimes our self-confidence isn't where it was. Sometimes we have days where we don't feel like it's ever going to happen. And what I've found is that with some encouragement, with someone who, like one of your great teachers in school, who believes in you, who not only believes in you, but my job is to reflect the truth back to you. And the truth is that you're meant to do this work. Sorry, spoiler alert. Your reason to be on the planet is showing up. Your reason to be on the planet is to do massage therapy, and to do so as a licensed massage therapist. Whether it's a short time or a long time since you've graduated from school, doesn't matter. Still your mission. Still part of the reason you're here on the planet. It's how you're wired. And guess what? Not everyone has this clarity. If you're listening to this, if you're participating with me in class or you're listening to this later, not everyone has this mission. Personally, I thought this was going to be a hobby for me. Turns out there was a bigger picture. So it's my privilege and my pleasure, my honor, to be on this part of the journey with you, to pull you through, to grab you by the ponytail, by the collar, and say, come on, let's go. Come on, let's do this. So with that in mind, let's do this. Today, we're going to be talking about the MBLEx content, and it can be a little overwhelming. It can propel you into the past when you're like, damn it, no one ever told me about this. It can propel you into the future. It's like, oh my God, how am I ever going to learn all this? Let's stay present. Let's just walk through what the content will be, and then talk about strategies to understand that content and to study what you need to study and what you don't need to study. By the way, I got an email, I got a notification, I got a message that asked, oh my God, how do I memorize origins, insertions, actions, innervations? Don't memorize origins and insertions of muscles. Don't memorize the action or the innervation. Don't do it. Don't fill your brain with all that stuff. You don't need it. Here's what you do need. All right. So this is the content outline for the Massage and Bodywork Licensing Exam. Now, I've sent this to you if you're on my email distribution list, but what I realized is I wanted to share with you where you find it. And you find it on the Federation of Massage Therapy on their website. So let's go there and let me just make sure. Oh, golly, this is hard when I have a screen open. I cannot see. All right, so we're just gonna have to do this. All right, let me get that more ready for us. All right. Sorry about that, guys. Like I said, like you've seen, technology is my friend, right? All right, here's what I wanted to show you. This is the Federation of State Massage Therapy Board's website. And if it looks different, it's recently changed. I mean, I'm on it at least once a week, if not twice a week. And this is a new launch. So it's called the FSMTB, Federation of State Massage Therapy Boards. So it's FSMTB.org. And you're going to click the menu and you see where it says MBLEx. And if you cannot see this, someone shoot me a note in the chat. Here again is the chat box. Shoot me a note in the chat if you can't see the next few screens, because sometimes Zoom cooperates, sometimes not. So we're going to go to this menu, MBLEx, and we're going to go down here to exam content. This is where you find your content. So a lot of words, go right down here. These are the changes that have been made recently, but here's the hot links. See this? Content outline in Spanish. You might want to do both if Spanish is your first language. Alexi, speaking to you. All right, Yanni, speaking to you. I got like half a dozen of you guys who prefieres hablar en español, and a veces, maybe, posiblemente yo voy a enseñar en español en el futuro. So maybe I'm going to talk in Spanish, teach in Spanish in the future. But here we go. This is what I'm going to be showing you today. This is our content. And we'll just stay on the screen for now. If it starts to get weak, then we'll go to a different PDF file. All right, here we go. So let's take a look first at the anatomy and physiology right here. A&P, anatomy and physiology. It's 11%. You'll see 11% of the test. 11% means you get 100 questions. So the math is kind of easy. If 11% of 100 questions, that means you're going to have 11 questions on A&P, anatomy and physiology. Let's take a look at what you need to know. So you're going to need to know the structure of the system, meaning how is that system put together? And here's all our systems. We've talked about this in class. We've covered all of the benefits of massage for these systems of the body. And we have also taken a look at the organs or the mechanisms, the actual structure of these systems. As you were learning the benefits, you are also learning what organs, systems actually were a part of that. So for example, circulation. We knew that circulation, it's the first one, right? Circulation is the circulatory system. So what's in the circulatory system? That's our blood, right? Vessels, heart, veins, arteries, capillaries. So that's what it means by the structure of the system. If you get really ambitious, you can trace a drop of blood through the body back to the heart. Through the heart, from the heart back to the lungs. The lungs are not a part of the circulatory system, technically. They're a part of what system? Look here. Which system are the lungs a part of? A big part of? Whoop. Respiratory. Yes, the respiratory system. And this is another example of best answer, right? So let's pause here for a second. Best answer. Now, when we trace a drop of blood, if you decide to do so, from the heart is where it gets oxygen, right? Goes to the body, distributes the oxygen, picks up metabolic waste like carbon dioxide, and heads back to the lungs. Lungs is where they dump the waste. As far as the CO2, we exhale CO2 and we inhale oxygen. That oxygen enters through our lungs, heads to the heart, and you can follow that all the way back. Now, a lot happens along the way as far as distribution of nutrients and that type of thing, but that's the general structure that we're talking about. So best answer, heart is a part of the circulatory system, lungs are a part of the respiratory system, but let's keep going. We need to know how that system functions. What's the purpose of the circulatory system? What's the purpose of the digestive system? What's the purpose of the endocrine system? Can you name at least one organ that's a part of the endocrine system? Hint, hint, fight or flight. What does the endocrine system do? Integumentary. What's integumentary? It's not the blood. We just said that's circulatory. What's integumentary? Okay. Yeah, it is. That's right. Skin. Exactly. So yes, so the system function. So what's the function of skin? Skin is to help protect us, right? It's also an eliminator of waste through our sweat, through our sebaceous glands. But mostly it's a protective system. It's our covering. All right, along with this A&P, how tissue gets injured and how it's repaired, And actually, concepts of energetic anatomy, I would say beyond the chakra system, don't worry about it. And let me see, just in case, I was told recently that not everybody knows what the chakra system is. I just put that name in the chat. If you haven't heard of the chakra system in the past, that's energetic anatomy. And so it's just good if you know the colors of the rainbow, you know your chakra system. Red, orange, yellow, green, blue, indigo, and purple. So if that's new for you, just Google it and take a look at a simple chakra system explanation. But that's what they're talking about, concepts of energetic anatomy. All right, let's move down. Kinesiology. Now, some people put anatomy, physiology, and kinesiology all together, but kinesiology is actually the action of the movement of a muscle. And so look at the components and characteristics of muscles, contractions, proprioceptors. It says that you need OI, like the origins, insertions, actions. I promise you, kinesiology, take a look, it's 12%, right? You see here? That means you're going to get 12% of questions, 12 questions about movement. There's 680 muscles. That's over 1,300 origins and insertions. Does that need to take up space in your brain? If you miss 2 questions because of origins and insertions, I would rather you memorize other things. For real. Sorry, I know that's like for all anatomy, physiology. Chiropractors listening to this are going to be horrified because everything is about that for them. Not for us, guys. When you get into the treatment room, you are not going to be talking to your clients about origins and insertions. It's good for you to know as far as how to work a muscle, but you can take continuing ed for that. We're talking about passing an entry-level exam, the MBLEx. So yes, in the future, when you're taking continuing ed, you'll learn a little bit more about this, and the importance will grow. But for right now, based on what you need to know to pass this test, skip it. All right. The joint structure and function, we did cover joints. Remember the hinge joints, right? The ones like our elbows and knees. So to know those kind of joints, and again, know them in general. I would love for you to be able to recite them, but it's actually not necessary. All right, range of motion, active, passive, resistant. Again, be familiar with these terms. If you don't remember what a proprioceptor is, go look that up. That is important. You don't have to memorize, but you do need to know the general concepts. All right, moving away from kines, we got pathology and contraindications, areas of concern, special populations. So what are those areas of concern called? Like behind the knee, they have a name anyhow. Well, it's probably in here. All right, overview of pathology. So pathology is just dysfunction of the body. There's a disease, there's some type of pathology going on. And we want to know the contraindications for those, and session adaptations, right? We've talked about that. I know sometimes it's like you look at the screen and it gets a little blurry. So contraindications, what is it called? The popliteal area, that has a special name. Endangerment sites. Endangerment sites. Those are areas of caution. It doesn't mean we don't work behind the knee, but we don't work in the middle part. You want to work the sides. That's where the hamstrings come down and attach to the medial and lateral aspects of the tibia. So where the hamstring comes down, it goes behind the knee and it attaches to the calf, to the tibia. And so we want to know that happens. We want to know we don't want to work in the middle of the knee. That's an endangerment site and an area of caution. But if someone has knee pain, absolutely work the lateral aspects of their knee. All right, let's go back to our content outline because that's our topic for today. All right, so an overview of pathologies, just understanding certain pathologies, contraindications. So special populations would be like pregnancy, it would be like someone in a wheelchair, and then what tools are good. If there are contraindications, can you use different tools? I've never gotten a question, never even heard of a question on the MBLEx about tools other than your hands. So areas of caution, special populations, classes of medications. Now, this is the one that sometimes people are like, OMG, what am I going to do? I can't memorize all this medicine. You're right, you can't. But you know what you can do? You can dissect the question. If you get a question about medications, all of this pathology is only going to be 12 questions on your test. So if you get a question about medicine and you answer it right, guess what? You're probably going to get another question about medicine. You know why? Because the MBLEx is actually trying to help you pass. I know it's doing so in a very challenging way, but because the MBLEx is a computer adapted test, that means when you get a question right, you're going to get another question that's more difficult, but worth more points. So if the MBLEx was a person, they'd be saying, oh my gosh, Jodi got that question about ibuprofen right, or about NSAIDs right, or about Coumadin. She got this question right for 5 points. We're going to give her a harder question, okay, about another medication that's worth more points because we're trying to get to 630 points. So the easier questions are worth less points. The harder questions are worth more points. So if you're getting hard questions, it's actually a good sign. Just saying. It's intimidating. We got to remember, breathe, slow down. This is your destiny. Can be a little hard in the middle of the test, I know. But know that it's actually conspiring to help. Not really, kind of by accident, but if it's a hard question, don't freak out. That just means you got an earlier one right. So that's a good sign. All right, moving along. Benefits and psychological effects of massage. So you guys know this inside and out. This is common sense. So the physiological effect on massage. This is when we talked about the mechanical versus the reflexive effect of massage, right? What's mechanical? When our touch has actually physically changed something, stretching the tissue, elongating. So reflexive effects would be things we don't touch. Things like lowering of blood pressure, a slowing down of the heartbeat. Those are reflexive effects. So the physiological effects of massage. So the mechanical versus reflexive. The psychological aspects and the benefits of touch. So reduce stress. These things are common sense, guys. Common sense. The benefits for specific client populations. So when we're talking about the benefits of massage in a specific population, so in a special population, so maybe that's athletes, maybe again pregnancy, could be diabetes, it could be a specific pathology. So benefits and physiological effects also includes D, the techniques. So do you remember the 5 techniques that we learned of Swedish massage? All right, come on, get your hands busy. Put them in the chat. We're gonna take a break here. Put them in the chat. What are the 5 strokes? Give me one. This is like Jeopardy. Got 30 seconds. I should do the Jeopardy theme, huh? Maybe I'll have that music next. All right. Yeah, you guys are like, you're doing something. You cooking? Are you like looking it up in a book? Google it. 5 strokes of Swedish massage. Do you remember effleurage? Oh, I think I spelled that wrong. Maybe not. All right, now that I gave you effleurage, what's the other one? Starts with P. I hear you. Petrissage. Good. Yeah, there we go. Yes, petrissage. So effleurage, petrissage. That's 2. Give me, come on. Little tiny back and forth. Not trigger point. What do you do to a trigger point? If you're in the seek and destroy phase of your career, you can find a trigger point and you can kill it. You're usually using friction. Oh, good. Yep. Vibration is number 4. Vibration is a little bit less aggressive than friction, but vibration is a flat palm or this. And then, okay, this one. What's this one? 5th stroke. Almost like a drum. Percussion, yes, or tapotement. That's the other one. Tapotement or percussion, yes. So very good. Those are the 5. So effleurage, petrissage, friction, vibration, look it up if you don't know what it is, and tapotement or percussion. And so each of those strokes has a different intent, right? A different physiological effect. If I've got someone with osteoporosis, do I want to whack on their back? No, right? Fragile, thinning of the bones. We don't want to whack on osteoporosis, someone with osteo. But if I've got a bodybuilder who's got armoring, do I maybe want to do a little wake up, a little wakey? Or if I've been doing long gliding strokes and the person's kind of asleep and it's 5 minutes till the end of the session, maybe that's when I want to use tapotement, right? Wakey, because that's what it does to the tissue. It wakes up the tissue. So those are called session adaptations based on the effect that you are producing within the body. All right. See, you know this. All right. Am I here? Yes. Okay. So the different types of strokes, the sequence of the application, you go superficial to deep. That's what it talks about, the sequence of application. How would you apply your strokes? You don't necessarily just go in with an elbow, right? All right, so applications of hot and cold. And remember that rice is no longer a thing. So RICE is no longer a thing. Rest, ice, compression, elevation, it actually doesn't exist anymore. Look it up. Because we've only got another 15, 20 minutes of class. So we've got half to go. All right. Overview of massage and bodywork modalities. These are things that you learned in school about the different types of massage and different types of bodywork. Things like, you'll want to know some different modalities. And some of them you may not have heard of yet. It's true. But you've heard of Reiki, but you may not have heard of Feldenkrais. So go ahead and just, type in bodywork modalities and, and just see, familiarize yourself with the names. You don't have to be an expert. Deep muscle tissue work. Do you know Rolfing? Is this something that you're familiar with? And this, again, is just a familiarity with massage and bodywork modalities is what they're asking of you. All right. And just notice 15, right? 15% benefits and effects. and then alternate bodywork modalities. You do not need to know Chinese medicine. In the past, we used to have to know some Chinese medicine meridians, and some things that I did not study in school, but we no longer have to know that, nor do you have to know the history of massage. I'll repeat that at the end. Let's focus on what we do need to know. 15%, 15 questions out of your 100 will be on the benefits and effects of massage. Here, 17% of the questions are going to be on client assessment, reassessment, and treatment planning. In our current massage model, this is difficult to say. Many places that I would recommend for you to work spend no time, give you no time for an intake, for a client assessment. The client will fill out the paperwork. It's usually to identify any major contraindications for the session. But assessment, if you are working at a spa, if you are working at a hotel, if you are working on a cruise ship, if you are working at a franchise, it's usually a 15-minute massage. Just doesn't seem practical to me. I'm sorry. I'm going on the record. But this is where assessment becomes very important. So you're going to do that initial assessment, and maybe you'll need to ask a few more assessing questions during your session. This is massage in practice. This is massage like boots on the ground, actually doing massage. You may need to ask some more assessment questions. And I'll tell you a true story. Not proud of it, but I'm finishing a massage. This is scalp massage, by the way. Just doing a nice little scalp massage, and I come across a very funny lumpy bump about right here on my client's head. And look, I've done like over 20,000, probably over 22,000 massages now. Me, personally, sessions. I have no idea what this is. So I asked the client, I said, what's going on here? Did you have a fall? Because it felt like if she had a fall, it would be a dent, right? It would go in, but this kind of came up. You know what she said to me? She said, oh, that's probably where I had my craniotomy. Craniotomy. She didn't mention it before the session. It wasn't on her intake. I gently removed my hands and said, oh, when was that? You can imagine that happened to you. Imagine you're rubbing on his head and she had a craniotomy, which means they drilled through her cranium. All right, back to reassessment. That's my story. That's the importance of doing a thorough intake. I did not do a thorough intake with that client. All right, 17 questions are going to be on assessment, reassessment, and treatment. So you're going to organize, the bodywork session. How do you do your consultation? You have a health history form. You're going to do a verbal intake, maybe. You're going to have a chance to walk down the hall with someone to your treatment room or see them sitting. What visually do you notice? Are their shoulders like this? Their head like this? Is there a postural analysis that you're going to do as you begin the session? Or if they tell you about a certain area that hurts, are you going to palpate? Are you going to touch it? Maybe if it's a shoulder injury, a knee injury, an ankle, maybe there's going to be a range of motion that you're going to assess. Maybe they're going to tell you, I can lift my arm this high on this side, and I can only lift it this high on this side. Now, this is where we get into critical thinking and clinical thinking. They're going to ask you to rule out contraindications, to clearly identify the goal of this treatment for the client. The goal for the client. Did you hear me say the goal for the client? Yeah. Now and then I want to do my massage on this client. That's not what we're here for. We're here to assess the treatment goal for the client. Granted, we want to have the best outcome, but we want to have the best outcome with the client in mind. All right. Evaluation of the previous treatments. Have they been treated for this before? Are they currently undergoing treatment for this? Again, this is client assessment, you guys. We have to be prepared that our client may have seen a medical doctor. What did the medical doctor say? Have they had previous treatment? Oh, they had shoulder surgery. Good to know. They had rotator cuff surgery. They had frozen shoulder. They had a manipulation to undo their frozen shoulder. All right, and that helps us to formulate our treatment strategy. So this is client assessment, reassessment, and treatment planning. All right, so now we're going to go into a different part of our brain. We've been in client assessment. We're here to serve the client. 16 questions here on ethics, boundaries, and laws. 15 questions here. 15 plus 16. That makes 31. 31 questions, approximately, that you're going to have on non-bodywork related information. It's 1/3 of your test is going to be on ethics, boundaries, guidelines to a professional practice. Just want to be clear, okay? So what is ethical behavior? In fact, our last lesson defined these words, right? Ethics, boundaries, values, morals. Kind of just revisit that vocabulary. What are professional boundaries? What is our code of ethics? And many, many, many times in these categories, we are looking for the best answer. Reminder, every question has 4 answers and distractors. Intentionally, there are distractors. I'm going to go back to telling you this eyeball to eyeball. Out of those 4 answers, there is going to be an answer that is there to distract you. That's the shitty part about the test. Sorry. To me, that's what makes it not entry level. Because you know what you know. They're just trying to distract you. That's why we are committed to finding the best answer, especially when it comes to boundaries, ethics, rules, laws. All right. Back to the categories. Ethical, the therapeutic relationship, dual relationships. If any of these terms seem unfamiliar to you, please. We talked a little bit before we started recording about transference and countertransference. This comes sometimes in this category of ethics, boundaries. Your scope of practice. We don't diagnose or prescribe. Confidentiality, HIPAA laws. All right. And knowing your guiding principles, knowing vocab words like principles and morals, values. Guidelines for professional practice. Isn't that what we just talked about? Nope, even more. All right. Proper hygiene. Massage therapists are taught therapeutic hygiene in school. Washing your hands for 20 seconds with soap and water, right? What did you sing? Happy birthday or Old MacDonald? Yeah, I was Old MacDonald. Yeah. All right. What are some, and this has been right in front of our faces for 2 years. What's safely practicing massage therapy? Knowing a little bit about body mechanics, when it's appropriate to use protective gear when necessary. never could we have imagined a pandemic, right? And just know that protective gear, if we're doing intraoral work, so, inside the mouth, that we always wear gloves. For a while, we needed to wear, we needed to wear masks, right? All right. Draping. What is safe and appropriate draping? How do you communicate about draping? You're not probably going to get a question on your exam about draping, to be honest with you, but I am passionate about proper draping. Secure the drape. No gluteal cleft. Secure the drape. Please, especially with cross-gender massage. But even with same-sex massage, I mean, if I'm working on a female, I palpate her arm. She's under the sheet and blanket. I palpate her arm. I palpate her hand through the sheet and blanket. I move the blanket over. Then I tuck the sheet under her body. And then I move the sheet. Practice your draping. While you're practicing and studying for the MBLEx, do some massage. Get a body on the table and practice this stuff. Mostly loose draping is around the leg. Tuck that sheet under. Notice how my palm is down. Tuck that sheet under the knee and then bring it up. Tuck it under the crest, the lower back. The what is that part of the back called? The lumbar, but it's, that. Tuck it under there. Tuck the sheet. Secure the drape. Often I have therapists tell me, oh, Jodi, I'm working on my husband. I don't need to secure the drape. Oh, I'm working on my wife. I'm working on my friend. Secure the drape. Here's why. It allows a person to relax more, especially that drape around the leg. We don't want any breezes, right? No, we don't want any breezes. We don't want any air getting through there. And same side, leg drape, same side. Don't do a cross leg. I don't care what you were taught in school. Try it on the same leg. Tuck it under the knee and right at the lower back. Palm down. If you need to hold the sheet, the fitted sheet underneath, secure that sheet, tuck, and down towards the floor. Little sidebar on draping, because I'm really very passionate about secure draping. Let's just put it that way. Draping, home stretch here, guys. Communicate about the draping, especially if you need to work the abdominal region, how you're going to secure that drape, how you're going to use the towel, and making sure that everyone stays modestly draped. You drape a towel over the chest to work the abdomen, or work the abdomen through the sheet. All right, business practices. Again, this is 15 questions on professional practice, but business practices. Knowing the structure of what type of entity you're going to be, a sole proprietor, an LLC, are you an S Corp, C Corp, are you an employee, are you a 1099? Sorry, I said that fast. Are you a W-2 employee, or are you an independent contractor, 1099? So you either get a W-2 that tells you how much money was taken out of your check, or you get a 1099, which is basically a tax bill saying what the amount of money you're going to owe taxes on. I'm a fan of being an employee, just saying. An LLC is a different conversation, or a sole proprietor is a different conversation. And I'm happy to talk to you about that if you want to have a discussion. That's your business planning, strategic planning. How are you going to keep your records confidential and also up to date? Are you going to need to do marketing? What's the kind of marketing you're going to want to do? Will you be doing hiring or interviewing? Where will you keep your records secure? And then there might be a little bit of healthcare or business terminology in this category as well. So as a brief recap before we close, anatomy and physiology is 11% or 11 questions on your exam. Kinesiology is 12%. Pathology is down here, 14%, 14 questions on pathology, which is usually dysfunction of the body, some type of weirdness in the body. And then benefits of massage is 15 questions. Client assessment, reassessment, 17 questions. Ethics, laws, 16 questions. 15 questions on guidelines for professional practice. That is your content for the MBLEx. And so, as you prepare, I'm going to make a few closing comments, and then I'm going to stay on the line for those students who are live in class to just have a word. But as you prepare for the MBLEx, it's easy to get down in the weeds. And at the beginning of the session, we talked about living too much in the past and oh, I'm a victim, poor me, just being aloof and arrogant, like I didn't get prepared right. That's living in the past. The future might be, oh my God, what do I do? How do I start my own practice? I can't take the MBLEx until I'm ready to start my own practice. That's future. That's fear, worry, projecting. That's too much future in the nugget. Too much past or too much future. I guess it'd be too much past or too much future. We're not in the present. We're not in peace. As you prepare for the MBLEx, stay in the present. It's easy to get down in the weeds, being, I've never even heard of proprioception. What the hell is that? Don't worry. Know that, I will reiterate this because I believe it truly in the deepest part of my heart. You're meant to do this work. You're meant to offer this, even if it's just to your family, even if it's just to friends, even if you never have the wellness center that you once thought you would. Let's start with today, the present. Let's just start with today. The next speed bump for you to get over is passing the test. And you're here preparing to do that right now. So congratulations. Check the box for today because you made a baby step forward, maybe a big step, but at least a baby step forward in being ready to confidently, calmly pass the Massage and Bodywork Licensing Exam. So I'm going to sign off on the recording for now. My name is Jodi Scholes. It has been a pleasure to spend some time with you today. Feel free to find me on patreon.com/Jodi Scholes, or just type in my name, Jodi Scholes, and see what comes up. You'll see a website. You'll see all that if you want to find me again. Feel free to shoot me a message if you want to talk more about your business entity and how you see your career kind of opening up. Good luck. Best wishes. Lots of love and light as you prepare to pass this test. And do me a favor, when you do pass, shoot me a note. I really do celebrate with you when you pass this test. So peace out for now.